Happy Thursday, everybody. It's Dr. Adam Smith at Ultimate Bariatrics. We did a replay for you last week because we were out of town. Dr. Robert stayed home and watched the fort while Dr. Novak, Dr. Snow, and I went. We were going to a meeting called IFSO, which is the International Federation for the Surgery of Obesity. And at the very last minute, the meeting canceled, but we were already booked out of work, so we went and took a few days off anyway, and then they did the conference virtually, which was really cool. But we really like this international meeting because, like many organizations, it seems like you hear the same old people giving the same old lectures every year, year after year after year, and it gets boring. With IFSO, there's an international flavor, so there are surgeons from Europe and South America and Asia and the US. And so there's a lot of things that are going on over there that we're not doing here. And I'm sure there are things that we're doing here that they're not doing there as well. But it's always nice to get fresh information. And what's really nice is sometimes getting a little confirmation of some of the things that you're doing that you might even be ahead of the curve on. So I'm going to talk about intragastric balloons today. We were very early adopters of this concept because our basic practice philosophy is everything we do from a surgical or a procedural standpoint is just a tool. It's just a tool that you use to maximize your opportunity to make a positive lifestyle change. So whether that's a lap band or a sleeve gastrectomy or a bypass or a duodenal switch or an endoscopic sleeve gastroplasty that I'll talk about in a minute, or a balloon, whatever you choose, if you use it well, you will succeed. So we were very blessed and fortunate to be in the FDA trial for this particular balloon way back in the day. It's been several years now. Its name is Orbera, and this is an actual Orbera balloon. It was really cool. This was the first one approved by the FDA for use in the United States. It had been used several years prior to that in Europe with good success. So we went to Rome to learn how to do this procedure, which was another story for another day, which is amazing. Trained with this wonderful surgeon, Dr. Jenko over there, who's just awesome at everything. And we learned how to place these balloons. And actually, Dr. Snow and I placed the first Orbera balloon in North Texas and maybe even in the whole state of Texas as far as we know, but definitely in North Texas, Dallas Metroplex. And we had great success. In fact, we placed it on a staff member. I'm not going to give out any personal information. She did great. So the way it works is we bring the patient in. Of course, we do an evaluation to make sure you're appropriate. You can't have had previous surgeries on your stomach. So if you've had a band or a sleeve or a bypass, this isn't for you. This is for a virgin stomach, so to speak. If you're reasonably healthy, we place it endoscopically, which is through the mouth. You're asleep, of course. It goes in empty. And then it's attached, it's wrapped around a little tiny tube, like an NG tube, only we don't stick it down your nose, we stick it down your mouth. And then we inflate it. This is filled with saline. And it sits here in your stomach, like this, occupying space. So when you eat a smaller portion of food, you're full. And then you feel full longer. This is designed to stay in for 6 months. This gives you enough time to get that jump start on your weight loss, start changing those habits, and make a positive lifestyle change. Our program isn't just 6 months though. Our program is for a full year. So we want you to meet either with the doctor or the dietitian or both, either in person or virtually, every month. Because at 6 months, we go in, we suck the saline out of this balloon and take it out, and then we make sure you stay on the right path with those positive lifestyle changes that you've made in those first 6 months. And when we first started talking about doing these, I thought, well, this is silly. As soon as we take that balloon out, everyone's going to gain their weight back. That has not been the case. The regain weight is no higher than it is with other surgeries that we do. Because a human being that's going to cheat and self-destruct, they'll find a way to do it. No matter how many people try to help them, they'll find a way to hurt themselves. But most of the people that have this procedure are keeping their weight off good. Now, how much weight can you lose? That depends on how much you need to lose, of course. But usually the people we see getting this procedure are people who have a body mass index that isn't high enough for one of our more aggressive surgeries, or they just don't want a permanent alteration of their anatomy. So our weight loss range we see between 25 and 50 pounds. And the weight regain we see is usually less than 10 pounds. So we're real high on this. There is another balloon that is approved by the FDA. We just can't get our hands on it right now. The company isn't producing any of them. We love competition. It wouldn't break our hearts to see another competitor come out, because anything that makes everyone try harder is good for everybody. So, but right now the Orbera is the one we have. We're really happy with it. If you don't want a permanent surgery, if you don't want your stomach cut, stapled, rerouted, but you really need some help losing weight, especially in the short term, come see us or talk to us, and maybe an Orbera is a good option for you. This is not our only scarless option. So what is really cool is the same company that has this Orbera balloon has a device that allows us to sort of mimic a sleeve without incisions. It's called an endoscopic sleeve gastroplasty. Now that's a lot of words, which basically means we go in on your stomach here, and this device, which goes through the mouth like an endoscope, allows us to place sutures inside of the stomach itself. And so we take and start kind of down here at an area called the incisura angularis to be precise, and we start placing stitches to basically make this part of the stomach smaller. So as you can see, if we stitch this stomach to kind of pleat it or make it smaller, it's going to very much resemble functionally this sleeve, where we are actually surgically removing part of the greater curvature of the stomach. We're really kind of optimistic about this. I think our group is doing probably as many or more of these procedures as anyone, but of course there's a lot of us. So we're seeing good results. We're seeing weight loss that is definitely comparable to the sleeve. And so this leads me to the meeting that we attended virtually. The company that makes the device that we use to perform this operation, it's not a separate brand new surgery, it's just a device that's mimicking an old surgery. They presented their data from their first several years experience, and the data is good. So if you're someone that doesn't want to have their stomach removed or bypassed, or have the nuclear option, the D-switch, but really need an aggressive surgical weight loss, don't want a balloon, there is other options available for you. So if you're interested in learning more, come see us at ultimatebariatrics.com, or make an appointment to see Dr. Snow or myself or one of the other surgeons here. If you want to talk about the endoscopic, totally oral option for surgical weight loss that's out there, both of these procedures, while are in common usage, and we do a lot of them, and we have really good outcomes and really good results, of course your third-party carrier is always going to look for an excuse not to cover anything. So it'll probably be another several years before they finally are forced to cover these very novel, innovative, and safe and effective techniques for weight loss. So right now, these are something that are not going to be covered by insurance. I don't know when, if ever, they're going to be. But if you're interested in this, come talk about this, or if you're interested in any of the other surgical options we offer, we're certainly willing to sit down with you. But if you have a BMI that's maybe less than 35 and over 27 or over 30, if you have a BMI between 30 and 35, you don't want a permanent cut or a stitch or a scar, We can talk about balloons. Certainly, no matter what your BMI is here for the endoscopic sleeve gastroplasty, needs to be certainly above 30, of course. Come see us. We love to talk about it. We try to stay on the cutting edge of technology. We're hoping to go back either to South America or Europe for some more advanced training on some newer devices that are coming down the road, and we'll let you know when they get here. So stay tuned for further news from Ultimate Bariatrics. Good to see y'all. Have a great week.